My road to get research is a little bit twisty. So I work as medical doctor in Indonesia. I've been working for 2 years in hospital, and but way back in med school, I actually very interested in genetics, even though we don't really have fancy labs back in Indonesia. But yeah, the big moment when I realized that I really want to lean toward research when I was in hospital, and when I saw patients with genetic disease like DMD, that's the name of the disease, or hemophilia, sickle cell anemia, the feeling that I can't really help enough to them really hit me hard. So I was just, okay, that's when I decided I needed to be part of the solutions. My work is based on DMD, or Duchenne muscular dystrophy. That's a disease that is one of the most common genetic diseases that affect young boys. So in DMD, the patient has a problem in a very big gene in our body that's called dystrophin, and this problem is, we call it as mutation, and this mutation makes the body cannot produce dystrophin. Well, if the body cannot produce dystrophin, it will make the muscle get weakness and all degenerated over time. So far there is no treatment for this disease, but there are some like ongoing clinical trials, or some like authorized approval trial treatment that can reduce the progress of this disease. And one clinical trial that has been very promising is transferring a mini version of dystrophin into the body. But there is some problem or some concern about this treatment is the sustainability, because in that treatment, the mini version of dystrophin is produced outside of the body. So that's why in my project, I'm trying to make our body as a producer of this microdystrophin. So by making our body to produce the protein that we needed inside the body, I hope that this treatment can be used just one-time treatment and it's very sustainable. PhRMA Fellowship really has a great impact on my research and career right now, because it's not only reduce my financial worries, but also it signifies my recognition and also dedication on this research. So with this fellowship, I get to know more people, and also I get to, yeah, at least I don't have to think about what should I do, like assistantship, teaching, or anything. In the next 2 years, I can just focus on my research and get things done, and hopefully this research can be as impactful as I want to be. It's very challenging because I understand that I'm doing something totally new here. So when trying to find a literature, there might not be in there, or there might be in there, but not in a way that we wanted. So it's just like playing detective right now. So just try it, and then when it works, sometimes I don't know why that works, and when it doesn't work, I don't know why it doesn't work. So it's just, I don't know, it's like making puzzle with billion pieces, which I don't know where these things goes. One thing that I always tell myself is that's okay to make mistake, and every mistake will teach you something that will push you forward or push you back. It's just like make you step back to learn more, okay, to understand what is this. My final goal is I really want to make a therapy. I know that this might not go somewhere, but I really want to be, at least if that's not me, at least this can be a stepping stone for someone to make a therapy from this project.